Good afternoon, everyone, and thank you for joining me today. I'm Jennie Montgomery. This is a special live edition of The Jennie Show. Now, you've seen the commercials for our scheduled show today, all about endometriosis. But a lot has changed in our community, our country, and our world in the last week. You can watch that entire show on our website, WJBF.com. Just click the Jennie link. But today, we're devoting our time to the coronavirus and its impact here in our community, in our homes. And that starts with talking about the practical things we can do to minimize our risk of getting sick and of passing the virus along to those with compromised immunities and other risk factors. What we can do right now is to practice social distancing. That's a term we've heard repeatedly in the last week, and it's so important that schools are closing and businesses are reducing the number of workers coming in or closing temporarily. 6 feet, that's how far the CDC says you should stay apart from people to practice social distancing to stop the spread of COVID-19. But scenes like these over the weekend at restaurants, stores, and on the street, not much distancing. Now a crackdown. Officials from California to Ohio, New York to New England, ending dining-in service at restaurants and bars. Police even cleared out New Orleans' iconic Bourbon Street as a new normal sets in.
I'm practicing as much social distancing as I possibly can. I don't go out.
The CDC hoping people staying in their homes will slow the spread. It even dropped its guidelines of limiting public gatherings from 50 people to 10. And this new normal, which we hope is very temporary, is causing stress on adults and our kids. So we've reached out to a professional who deals with anxiety, depression, and PTSD. Dr. Bernard Davidson is an associate professor of psychiatry and health behavior at the Medical College of Georgia at Augusta University. And first of all, let me say, Dr. Davidson, thank you so much for being here with us today. It was very short notice for you, but as you know, this whole situation has everybody in all different fields. It's affecting all of us. It's unexpected at a time, or not unexpected, I should say, that fear is pervasive right now.
I don't think it's unusual that that people are fearful.
Right.
I think that's expected. I think the most important thing is we need to focus on what can we do to keep things in check for ourselves.
That's right. And so we're talking about, people concerned about, do I have enough supplies? Okay, so you don't need to panic about that and go out and like we've seen the toilet paper thing. We saw people go crazy and do that.
Yeah.
Even now you walk in the grocery store and the paper aisles are just empty. But one thing that I think is proactive to do is make sure that shut-in down the street or that elderly neighbor, if they need something, they may be afraid to go out because they know they are a risk factor. So sometimes I think that you can mitigate our own fear a little bit if we're looking out for others.
Right, you couldn't have said it, I couldn't have said it any better than that. What you've said is really, really important because a number of things are occurring there if we kind of, look at it a little closer. One, we're helping someone. In a situation where we're feeling helpless, when we're getting bombarded with media stories that are changing so fast, you want to get some sense of what do I have control over? And to a large extent, helping a neighbor, an older neighbor, a grandparent, bringing supplies or food down there, is going to give you some sense of increased self-efficacy, and that's going to calm your own anxiety and keep yourself in check. You're going to feel like you're getting something done that's helpful. And that's kind of antithetical to feeling anxious.
I have a 27-year-old son, and he lives in another city, and I see where I feel is really, really overreacting, and I'm trying to give him just some tools of things he can do because I think that's where you do, as you said, get a little bit of control. There's so much we can't control right now. We're dealing with something none of us have dealt with before, with this unknown, and seeing the way it's spread in our society.
I think one of the things we want to remind ourselves is that our country has gone through a number of unknown and unexpected or severe situations, from the Spanish flu to 9/11 to the stock market crash of 1929 to 2008, the tech bubble, and other things that have really rattled folks.
Right.
And this, of course, is unique in its own ways, but we have come together at times of unknown and uncertainty, and we have gotten through it, and we need to remind ourselves
that we have
gotten through it.
And many of us, and those of us who are parents, certainly remember everything about 9/11. We remember where we were. We remember the country coming together. And I think that as we did at that time, we were concerned about how to help our children process the information. And I think right now, you know, they can't see something like planes crashing into buildings. You know, the children just know, oh, okay, well, I'm not going to school. And I think that that's where schedules and keeping some kind of normalcy in their life is important. But ones who are a bit older, high school students, college students, you're looking at high school seniors who are having a real emotional time right now because they're feeling like a large part of their senior year has been ripped away. I heard stories yesterday from parents whose kids came home very tearful because they knew I may not be back at school with my friends after spring break, because of course this is going to last through spring break at least. We're missing so many things. Will we have a prom? All these things.
Sure.
How do parents talk to those kids?
Well, the situation that looks like we're all going to be facing is increased social distancing and staying at home more, and changing that into an opportunity to spend time together where we may not have taken advantage of that time together with so many distractions. Not that we would want something like this to happen to bring us together, but the fact is we're going to be home.
We're going to be home.
And the more we plan on setting up some activities, maybe we always talked about we're going to play some board games.
Yeah.
I just never got around to it. I did something the other day that's really minor. I bought these outdoor solar lights in November. I said I'm going to put them up.
Yeah.
I finally put them
You
up.
put 'em up.
And I felt good about it.
Right.
And it distracted me from watching the same stories over and over and over and over again. And I got lights on now that work from
I'm
when it
very
gets dark.
glad with something you just said. It stopped you from watching the same stories over and over again. I do want to talk about the media and the influence the media is having right now, and we'll get to that in just a moment. First of all, let's show you the number you need to call. AU has a terrific hotline number about COVID-19. It's on your screen, 706-721-1852. You can call that with questions. You can also go to the website, augustaexpresscare.org. There's an app you can download, and it will have a lot about the symptoms and a little screening you can do right there. Stay with us. We'll have more with Dr. Bernard Davidson right after the break. Monday afternoon, officials at Augusta University held a news conference to address 2 presumptive positive cases of coronavirus here in the Garden City. President Dr. Brooks Keel was joined by colleagues from the medical college who talked about the importance of good infection control measures and reassured the public that this public health emergency isn't catching Augusta off guard.
In short, and I've said this before, and I'll say it many times, we have been over-prepared for such an event so that we do not have to overreact to a situation like we find ourselves in. We have an extensive plan for a situation like the one we find ourselves in today, and we are effectively implementing. We've been able to bring the full resources of our institution to bear on this crisis. Our researchers have been in the lab and have provided us with a limited testing capability that will allow us to more quickly manage cases that appear in our community. Our teams have developed a web and app-based platform to facilitate virtual screening of patients who may be experiencing symptoms related to COVID-19 that will allow our healthcare providers to care for our patients without taxing the valuable services of our emergency department and what it provides.
Dr. Bernard Davidson is an associate professor of psychiatry at the Medical College. And Dr. Davidson, I felt a great sense of confidence when I was watching that news conference yesterday when Dr. Brooks talked about being over-prepared so we aren't overreacting. We've seen so much overreacting in our community, especially as we were speaking earlier, the grocery stores. And I know a lot of people are really questioning how much, is this a media hyped event? What are your thoughts about that?
Well, first of all, I think being over-prepared is not the same as overreacting. I think being over-prepared is great. And a similar comment was echoed by Dr. Fauci when he was saying that people are saying, you're giving so much information out and you know so much, and he said, good. We want people to get that. We want to say it over so they know washing their hands is important,
right,
and they know what they can do. So it's the kind of over-preparation or information that's exchanged that's helpful and can help reduce anxiety and help people keep it in check, which is different than obsessively immersing oneself and listening to either the same stories on the media or reading the same articles in different sources over and over again and drawing your own conclusions on how things are going to end and usually escalating it up.
Yeah, escalating to
Sure.
everything that we've seen in a disaster movie. You know, that's what a lot of people are playing out in their heads. And I wonder where we do draw that line from watching too much TV or reading too many things. Where does it cross that point and then it becomes paranoia?
Being informed is incredibly important. Being obsessively consumed with getting information is a different situation as far as, I see it. We need breaks, we need diversions. There's other things.
Yeah.
We need to focus our time, and especially with social distancing, and most of us,
are doing
being at home, as I mentioned before, preparing activities, working together, maybe starting up hobbies that you were saying you were going to do for a long time and you kept pushing off, and making that meaningful. Using social media in a positive manner, not looking at the catastrophic stories that are being propagated on social media, which are going to generate your anxiety, but using the platform, talk to relatives, talk to grandparents who have, smartphones or computers where you can either FaceTime or Skype with them. Maybe pick up a telephone and call people. A lot of people don't do that anymore. And put the texting down for a while. Have some conversations. Talk about things. Share things.
My daughter works at a local church, and she was talking about how, we know church services in many instances are canceled, and she was talking about some of the struggles with visitation, and especially visitation with the shut-ins and whatnot when we're supposed to distance. And she made the comment, Jesus visited the lepers. And I said, yeah, but Jesus didn't have a cell phone either. Maybe this is when we use that technology and we make those phone calls to people when we can't visit in person. And like you just said, pick up that phone and let somebody hear another voice. Even if we can't see them.
The technology allows us to have a group call.
It absolutely does.
I mean, most cell phones and smart devices and computers can have chat rooms.
Yeah.
So, virtually visiting isn't the same as physically being there, but it's a lot better than isolating.
Isolation. I appreciate the guidance that you have given us and how to make sense of what's happening right now and not be afraid, but to make sure that we keep ourselves informed. Dr. Bernard Davidson, thanks again for your time today.
You're very welcome.
And we do want to show you the number one more time, 706-721-1852. And you can go to the website, augustaexpresscare.org. Coming up on Jennie, it is an operation that serves the families of critically ill children at the Children's Hospital of Georgia. And now, the Ronald McDonald House needs your help. Beth Murdison joins me right after the break.